Hi, this is Dr. Bhargava, and I have a few interesting cases to share with you. Our first case is a patient with history of small bowel carcinoid. They had the carcinoid resected a few years ago, and they presented with rising chromogranin A, which is a tumor marker for neuroendocrine tumors, and they underwent a copper 64 dotatate PET CT study. Here's the rotating image. And so at the site of prior surgery, we don't see any local recurrence, but in the pelvis, we see these multiple foci of intense uptake. Otherwise, we see physiologic uptake in the salivary glands, pituitary, liver, spleen, and excretion from the kidneys into the urinary bladder. The CT and the fused PET CT images show these foci of increased uptake. Here is a soft tissue density which takes up the radiopharmaceutical. Here is another cluster of densities that show intense uptake. And so this patient has peritoneal metastases from small bowel carcinoid. So for evaluation of neuroendocrine tumors, we have gallium-68 dotatate and we also have copper-64 dotatate. And this is a good article comparing the two, the copper-64 dotatate and the gallium-68 dotatate. Our next patient presents with a mass in the right lung, and they underwent a whole body FDG PET CT for staging. There is uptake in the right lung mass that we see on this rotating image, also focal uptake in a subcarinal lymph node that we see here on the fused PET CT image. And separately, they underwent an MRI of the brain with and without contrast, which shows this enhancing focus in the right temporal lobe and the surrounding edema. And as expected, the brain metastasis is not FDG avid, and this is not uncommon. We frequently find that brain metastases are not hypermetabolic on PET, and we know that the yield of scanning the brain on a whole body FDG PET CT looking for metastatic disease is low. Here are two good papers on this topic. In this first study, the authors summarize that the inclusion of brain routinely in whole body FDG PET CT studies detected previously unknown metastasis is only 0.7% of studies with negligible impact on staging. And in the second paper, these authors summarize that brain scanning as a part of whole body scan cannot replace routine imaging techniques, which is MRI with and without contrast, but in case of positive findings, provides early and crucial information for further patient management, especially in asymptomatic patients. Here is our third patient. They presented with a CT of the abdomen and pelvis with contrast, which showed these abnormal soft tissue densities in the abdomen and also in the pelvis. The spleen was absent, and so this patient underwent a technetium-99m sulfur colloid liver and spleen scan, and a planar image is shown here on the right with physiologic uptake in the liver, faint bone marrow activity, and all of these soft tissue densities showed increased uptake of technetium-99m sulfur colloid. You see them here in the left upper quadrant and also in the left lower quadrant in the same distribution as the finding that we see on the CT. So this patient was diagnosed with splenosis based on uptake of technetium-99m sulfur colloid in these abnormal soft tissue densities. And here's a good article on this topic, abdominal splenosis and its differential diagnosis, what the radiologist needs to know. Thank you for watching.